Hello, I'm Jason Thompson, and welcome to this session of the Seek Color Certificate program. In this session, we're going to talk about microaggressions and cultural communication. A lot of times people forget that a major part of language, a major part of culture is language. And it's important to understand the intersection of the two, and that's what we're going to talk about today. Um, so just a little bit about my background. I've worked in diversity probably 25, almost 30 years. I've held positions in a healthcare organization, within the U.S. Olympic and Paralympic Committee, within a startup, as well as a university. I've written a book on diversity as well. And so quite a bit of background in diversity. I'm not actually a healthcare provider, but I can speak to issues around diversity. So today, what we're hoping to achieve. Number one, we want to define microaggression and culture communication and what we mean by that. So we'll talk more about that. The second thing, we'll give some examples of culture and microaggressions and how they impact or can impact equitable outcomes. And then you can write things in the chat, so you're encouraged to use the chat as we're going through this. Feel free to type. I'll be in the chat as well. There'll be time throughout as well as at the end for you to put any comments or questions. So what is this a picture of? And it probably seems like maybe even too simple a question. Like, what is this thing? Why would I even show this? And almost everyone probably knows this is a storage unit. Now, the reason I bring this up is several years ago, we had an exchange student from Spain. And so as we would drive around town, he would just point at things. What does this mean? What does that mean? Or, what is that thing? And so we drive by, obviously, a storage unit. And he says, well, what is that? And I was like, storage unit. It seemed overly simple to me. And he's like, I don't get it. And I was like, when you have too much stuff, you just take it there and you store it. And his take was, too much stuff. He just couldn't make sense of this thing. And then it realized, like, we tend to be very US centric. Obviously, how we see the world, it's a natural response, right? But it was one of those things that didn't quite make sense, because for him, it was like, why would you have too much stuff? Why would you need to take stuff somewhere and just put it in a storage unit and save it? Like, this didn't make any sense to him. And so that's why it's so important to understand that we have a culture. Many times people say to me, well, I get culture, but I don't think I have one. And without realizing, no, you do have a culture. The reason you feel like you don't have one is because it's reasserted to you all the time. And the storage unit is a perfect example, or even a metaphor for this idea, right? This concept of, we live in a country that has so much excess, we just take it places and store it, even if we have no use for it. And so that's why I wanted to give that example, because it helps us hopefully put this in the context. Oh, there is a culture. How do we understand this? And all cultures have a language and a jargon. And many times it's a language that's very unique to it. So storage unit is very unique to the US, and healthcare has a language that is also very unique to healthcare. And many times we forget when we work in healthcare, because we're so used to the terms, that we have a very unique culture. And the reason I bring that up is, this is a good example, nuclear medicine. And it used to kind of make me chuckle, actually, when I used to work in healthcare, because in most contexts, the term nuclear is almost always negative. Like nuclear war. You would never, oh, that's the nuclear option. Rarely is that a good thing. In healthcare, it actually is. It can be helpful to a patient, right? And so nuclear medicine, I think, is important that we think of that term and how it might be received in the context of the culture, right? That this culture we have, many times we're used to terms that we say all the time without remembering how it might be received. And this little phrase here was actually found in a brochure. And it kind of caught me a little funny that it actually says you will be slightly radioactive for a limited time. Like, being radioactive is generally never a good thing. And so you can see how for many patients, this would be unsettling. And then when you add the combination of this word cancer, that many times we forget when we work in healthcare, we say cancer all the time. We talk to patients all the time. But for the patient, it's still the first time. So within the culture, we've become somewhat desensitized, but the patient isn't. And I remember several years ago, my father was diagnosed with cancer. He had colon cancer. And one of my most vivid memories of that is, obviously, he calls all the kids and we all come home on that day. We lived relatively close. We could drive. So I drive to his house, and, obviously all of us are somewhat unsettled by this information, and what's going to happen next. And he'd gone to the doctor that day, obviously. And I said to him, well, weren't you supposed to go back tomorrow? He said, yeah. And I said, well, where'd he go? He said, I don't know. And I said, didn't they tell you? He said, yeah, they told me. But he was so, kind of, all he heard was the word cancer, and he couldn't make sense of anything else. Obviously in shock, if you will, right? And I remember saying, are you sure you don't know where to go? And he's like, oh, I don't know where to go. And so I looked in his paper and I was like, Dad, you just go back to the same office. And I could tell he was just so unsettled by this term cancer. That's all he heard. So it's important to understand, like, we have this language and this jargon that we use in healthcare all the time that's received differently, that people think of it differently. And the term for them is the first time. And the word itself can be very unsettling to the patient. Another thing that we need to study historically, understanding US culture and the history of US culture is very, very important here. And the reason being is many times we think of segregation. We often think of in these photos like this. This is a photo of Ruby Bridges. She was 5 years old and she integrated to school and she had to have armed guards take her into the school. Many of us know this and we've seen this picture and it's an iconic photo. Or we think of segregation or integration of, lunch counters. And so we often think of that image in our mind. We don't often think about the fact that healthcare was also segregated. My father grew up in a very segregated part of Oklahoma, rural America. And what is the impact of that? Why is that story so important? Well, number one, the quality of care he got was essentially, for him when he grew up, people don't realize his birthday is actually wrong. And the reason his birthday is wrong is because his mother gave birth to him in the field. This is the experience of African Americans of my father's age, who's basically in his mid 80s now. Essentially, what happened was when the field nurse came, she said, well, today's his birthday. And my grandmother said, no, he was born yesterday. And her response was, no, your child's born when I say your child's born, and I'm here today. And so today's his birthday. That's actually what went on his birth certificate. So his birth certificate is actually incorrect. And people don't often understand the context and the history of segregation and racism in the US. And because it's so important, we need to know that here. Why is it so important here? Because it means that experience means, I need to go back when I apologize, is that many African Americans have a very limited or no documented clinical family history. So for me, my father's history is very limited, but his father's even less. So many times when I'm filling out the medical history, people will say, well, what did your grandfather pay us of? What did he die of? I'm like, I don't know. I don't have any clue. There's no medical history. He was basically grew up his almost entire life segregated in a segregated America. We're only one generation. My father, all the way through high school, was segregated high schools. It's not that long ago. And so if the high school is segregated, so was the healthcare. And the healthcare they got was very limited. And then you add the fact that it was rural America. Many rural Americans have even less healthcare. We still struggle with that to this day, but you can see how this history of the US and knowing it and putting it into context is so significant and important. And the reason it's so important is because it means that this documentation that we think we need to help treat a patient can be very limited. And it's limited because we have no medical history. And I remember years ago, I went to get a checkup and the nurse was very adamant and condescending towards me, that fact that I couldn't tell her what my grandparents had passed away of. And she kept saying, well, you need to go find out. And I was like, there isn't any way to find out. It isn't that easy. There's no medical record, right? And you'll see that many immigrants have the same thing, right? You come from another country, you may have came in under conditions in which you weren't able to bring your medical history, or they don't exist in that country. And so these things are super important to understand. What's the history of the culture? And then these things kind of lead to microaggressions, how we interact, the things we say. The fact that someone says to me, oh, you should have this medical history, speaks to this idea of bias and privilege. And so that's why on this slide, its importance of a shared language is so important. Privilege is one I often get a lot of pushback on. People say, Jason, I don't have any privilege, right? I work hard. I grew up in, middle-class America. Just because I'm white doesn't mean I have privilege. I work hard. And the thing is, I'm not taken from that. But there is a form of privilege that many white Americans have, and that's a medical history. Many African Americans were systematically removed. We don't have this medical history. That medical history is important information, but we don't have it. And the reason we don't have it is because of the history of the US. And so that's why it's so important to have this shared language, because when we can understand how privilege works, we can also understand bias and unconscious bias that's naturally inherent in a system that has that history. And so us using these terms, and that's why this morning I talked about definitions, is because we need to have this shared language. We need to understand a shared language in the context of healthcare, but also understanding the history of the US allows us to have a more complicated, and I apologize, but this allows us to have a more complicated conversation, right? A shared language helps us to have a more robust discussion. So I apologize, a more robust discussion. What do I mean by more robust discussion? It means that we can use terms like privilege and you go, oh, I can put this in the context of privilege in the sense of the history of the US or forms of bias that are inherent in the system. And once we can do that, we can more apt to come to solutions. We can have this complicated conversation about the history of the US, how that intersection is impacting what we deliver today in healthcare, and then understand bias, privilege. These terms make sense in terms like microaggression. I often hear people say, I didn't mean that. I don't understand what's a microaggression. And it makes sense that people struggle with it because microaggressions are complicated. How are microaggressions complicated? Well, one of the things is they're very situational. And many times, for example, you can ask a person a simple question, go, well, I didn't mean to offend anybody. I don't understand why they're offended by this. Well, it's because context is important. What do I mean by that? If we look at these photos, do you speak English is a very good one. Many times people think, well, this is a simple question I just asked. But really, why are you asking me that? What were you thinking when you asked me that? I think another good one that many providers can probably relate to is, nurse, can you find me a doctor? Right? Like that's one that I think many people in healthcare can probably relate to and understand why that might be a microaggression. I think many of my Asian friends will say to you, when people ask me where I'm from, sometimes I'm like, oh, I can tell. They don't really want to know where I'm from. They want to know what kind of Asian I am. And I get this question 8 times a day. Clearly, the person may not have the intent, but the impact is what we're talking about. Like, why do you keep asking me the same question? And that's why I often say, what were you expecting? And by that simple framing helps people better understand microaggressions. For instance, can I see the doctor? You don't look like a physician to me. Like if you just simply ask, what were you expecting? Helps a person understand stereotypes, privilege, microaggressions, right? Start to make sense. Do you speak English? I haven't said a word yet. Never asked me if I do I speak English, right? What does that say? What were you expecting? What are the assumptions you're working from? This is one that I think many people who are in the LGBTQ community can easily relate to. When someone says to you, we're a same-sex couple, and they often ask, who wears the pants? Like, not understanding how that would be received as something that's extremely offensive, right? And then these ones are interesting too. Do you take street drugs? Like, obviously in healthcare, this is a question we have to ask our patients. But I often think of my daughter, who's young, African-American female, and many times she'll get the same question 4 or 5 times. There's a couple times we've been in the ER, and it's like, she can't tell them, no, I don't use street drugs. And the more she says no, the more they keep asking the question. So after a while, we're like, what were you expecting? What is the assumption you're working from that you keep asking me the same question? And so it's important to understand how that would be received as a microaggression, how that therefore impacts the culture, and whether or not I'm willing to come back in the culture of healthcare, how it sees me as an individual. So hopefully that's helpful to you as an overview of why it's so important to understand microaggressions, put them in the context of culture, the culture of healthcare, understand that the culture of healthcare there's very unique culture within healthcare, the language and the terms we use within it. If we can put all those things in the context, hopefully it can help us reduce health disparities, but more importantly, create equitable outcomes. So thanks again. Hopefully this is helpful to you. Feel free to write things in the chat. As I mentioned, I will be in the chat. I can respond to questions and comments. And thanks again for being part of the SEEK program.